Hello, I am Dr. Sudarshan Pandit. I am consultant hematologist, hemato-oncologist and bone marrow transplant physician. I am currently working as a senior hematologist, hemato-oncologist and bone marrow transplant physician in Cancer Center of America, Nashik. Blood cancer is absolutely curable if the patient presents early without any complication. Some type of blood cancers like pediatric B cell ALL, the cure rate is almost 95%. Again, in some type of blood cancers like acute promyelocytic leukemias, if the patient within 15 days, and so after 15 days the cure rate of acute promyelocytic leukemia is also almost 95 to 98%. So yes, definitely blood cancer is curable. You have to present the patient very early to the hematologist and take the treatment as early as possible. Stem cell transplant is a type of transplant in which the patient itself is a donor. So what we will do in autologous stem cell transplant, we remove the stem cell from the patient and preserve, and then give the chemotherapy to the patient, and after that chemotherapy we again reinfuse that collected stem cell of this patient, and the reinfusion of the patient's own stem cell is known as autologous stem cell transplant.